Thank you very much.
You can take some here, and she can take some over there. I'll pass this to the audience. Are there any questions for Dr. Montez?
Yes, ma'am.
Regarding the calcium that you find in the arteries, does the calcium that you take as a vitamin have anything to do with what's found in the arteries?
I would say yes and no. Maybe actually that's a question that she might be able to answer better than I could. But essentially, the composition of the fatty plaque is a complex matter. But essentially, what is important to know is that calcium is a marker of diseased artery. When there is calcium in the artery, then basically there is a damage to the wall that basically can just stay the same or get worse. You taking extra calcium tablets, like, for improving your osteoporosis, should not really have to do with making yourself worse. And the way that the fatty plaque in the artery, or the calcium in the fatty plaque in the artery is formed, really is not going to be affected by the calcium you take for osteoporosis, for example. Yes, ma'am? You can speak up. Well, very good question. Essentially, most people present to their doctor because of chest pain. The minority of people are like you all here, who are very interested in health and getting yourself better. So typically, majority of people will present with chest pain, shortness of breath, and will present to the ER or to the doctor. And eventually, depending on their history and their risk factors, what I mean by risk factors are diabetic, high cholesterol, hypertension, family history, smoker. If you have any of those risk factors plus chest pain, then the likelihood of you having coronary artery disease is higher. And the way that the doctors typically see it is, what's your risk? So depending on your risk, you might go several ways. Typically, if you have a low risk and you're not complaining of, a lot of chest pain, they might just treat you medically. But when things are a little bit more risky or you have severe chest pain, then that's where you enter into the imaging world. Right now, typically, imaging of the heart is done with ultrasound initially, and typically the cardiologist is the one to perform that. And that's the best way to start, typically, is to look at the motion of the muscle, okay? So typically, you don't start by directly looking at the coronary artery, okay? This study that I explained today is not cheap. It's a little costly. But hopefully, insurances will deal with that. And right now, remains to be seen. But cardiac CTA is not the first line of imaging. Typically. So when would you get a stent? Well, you probably would stumble into the situation where you have chest pain. You see your cardiologist. They do an ultrasound. They see your heart muscles not working very well, and they want to do a stress test. So you could do a treadmill. You could do a nuclear study, and then they find that you have what they call ischemia. And then, they say, well, I don't want to do an invasive study on you. Or you say to them, I don't want to get an invasive study right now. I prefer to get a cardiac CT. So that's where you would enter into the situation. And then if I see stenosis or narrowing, then I would recommend for you to get